Have you ever heard of Bell's palsy striking new moms shortly after childbirth? It's real. In today's episode, we're diving into what causes Bell's palsy after pregnancy and why your beautiful postpartum journey might come with some unexpected challenges. Bell's palsy is a condition where the facial nerve, the nerve that controls your facial muscles, suddenly becomes inflamed or compressed. This causes sudden weakness or even paralysis on one side of your face. But why after pregnancy? Here's what experts believe. 1. Hormonal changes. After childbirth, your body goes through major hormonal shifts. These sudden drops and surges can affect nerve health and immune function too. Fluid retention. Pregnancy causes your body to hold on to extra fluids. This swelling can compress the facial nerve inside its narrow canal, triggering Bell's palsy. 3. Weakened immune system. During pregnancy, your immune system changes to protect your baby. Postpartum, your immunity may be lower, making you more vulnerable to viral infections that can inflame the facial nerve. 4. Stress and fatigue. Giving birth and caring for a newborn are extremely taxing on the body. Stress, sleep deprivation, and exhaustion can weaken your body's defenses, opening the door for nerve inflammation. 5. Viral reactivation. Some viruses like herpes simplex, the one that causes cold sores, can stay dormant in your body. After the physical stress of childbirth, these viruses can reactivate and affect the facial nerve. Other symptoms may include difficulty closing one eye, trouble eating or speaking, or an inability to control tears or saliva on one side of the body. The good news? Bell's palsy after pregnancy is often temporary. Most moms recover fully within few weeks to a few months, especially with early treatment, physical therapy, and lots of self-care. If you notice sudden facial weakness after having a baby, don't panic. Seek medical help right away. Early intervention makes all the difference. Your postpartum journey may come with unexpected bumps, but remember, your strength runs deeper than you know. About 85% of people with facial nerve palsy recover fully with treatment within 3 weeks. However, some people may experience long-term effects from the condition and require ongoing treatment. The most common cause of facial nerve palsy is an unknown, and it is idiopathic. One theory suggests that facial nerve palsy develops due to swelling from inflammation that affects the facial nerve as it exits the skull. Although the exact cause remains unclear, understanding potential causes may lead to effective prevention and treatment strategies. A recent study explored whether pregnancy and delivery-related factors contribute to facial nerve palsy development. Researchers analyzed data from over 37,000 women who had given birth to a single baby at 39 weeks of gestation or earlier. They found no association between facial nerve palsy and mode of delivery, gestational age, or birth weight. This finding aligns with previous studies indicating that advanced maternal age increases the risk of complications during pregnancy and delivery. Furthermore, researchers observed an increased risk of facial nerve palsy in women with diabetes. To prevent facial nerve palsy from occurring, it is essential to take precautions against conditions that may trigger it. These measures include getting vaccinated against preventable viral infections such as measles, mumps, and chickenpox. Additionally, maintaining good health overall can help reduce the risk of complications during pregnancy and delivery. It is important to note that these preventive measures do not guarantee complete protection against facial nerve palsy. More research is needed to determine if other factors contribute to its development. The diagnosis of Bell's palsy is typically made through a physical examination and review of the patient's symptoms and medical history. There are no specific laboratory tests available to diagnose Bell's palsy, but your doctor may perform tests to rule out other conditions that may be causing your symptoms. These tests may include a blood test, a hearing test, or an MRI of the head and neck. Once Bell's palsy has been diagnosed, treatment typically involves a combination of medications, rest, and self-care measures. Medications such as corticosteroids and antiviral drugs can help reduce inflammation and alleviate symptoms. However, the effectiveness of these medications is still debated, and more research is needed to establish optimal treatment protocols. In addition to medication, Applying a warm compress to the affected area may help relieve pain and discomfort. Getting plenty of rest and avoiding strenuous activity can also aid in recovery. For individuals who experience difficulty closing one eye due to Bell's palsy, lubricating eye drops and a protective shield can help keep the eye moist and protected from debris. In some cases, facial nerve palsy may resolve on its own without treatment. However, seeking prompt medical attention is crucial for a timely diagnosis and appropriate management of the condition. Early intervention can help improve outcomes and reduce the risk of long-term complications. While Bell's palsy is generally a self-limiting condition, meaning it typically resolves on its own over time, there are instances where the symptoms may persist beyond the typical recovery period. In such cases, further evaluation and management may be necessary to address the underlying causes and prevent long-term complications. For instance, if a viral infection is identified as the underlying cause, antiviral medications may be prescribed to target the specific virus and halt its replication. Based on the findings, a multidisciplinary approach involving neurologists, oncologists, and potentially surgeons may be implemented to manage the condition. It is important to note that the treatment approach may vary depending on the individual patient's circumstances. Factors such as the severity of symptoms, the duration of the condition, and the underlying cause, if identifiable, will influence the choice of treatment options. In addition to addressing the underlying cause, supportive care measures may also be recommended to alleviate symptoms and improve quality of life. These measures may include facial exercises to strengthen the affected muscles, speech therapy to address any communication difficulties, and nutritional counseling to ensure adequate intake of essential nutrients. While Bell's palsy typically resolves on its own, there are rare instances where the condition may lead to permanent facial nerve damage. In these cases, the affected individuals may experience long-lasting facial paralysis, which can have significant impacts on their appearance and daily functioning. Fortunately, advancements in medical technology and surgical techniques have provided new hope for individuals dealing with permanent facial nerve damage. This non-invasive technique involves placing electrodes on the skin near the affected facial nerve. By delivering mild electrical impulses, this method stimulates the facial nerve and helps activate the associated facial muscles. Regular sessions of electrical stimulation can gradually improve muscle strength and coordination, leading to better control over facial expressions and movements. In more severe cases, surgical intervention may be considered. One surgical approach involves transferring a muscle from another part of the body, such as the shoulder or chest, to the face to replace the function of the damaged facial nerve. This procedure, known as a muscle transfer, can help restore facial mobility and improve the ability to control facial expressions. In conclusion, while permanent facial nerve damage due to Bell's palsy can have significant implications, there is hope for individuals seeking treatment options. Advancements in medical science have led to the exploration of Botox, electrical stimulation, and muscle transfer surgery as potential therapies. These treatments offer the promise of restoring facial symmetry, alleviating symptoms, and improving the quality of life for those dealing with the lasting effects of Bell's palsy. That's all for today's video. Thank you for watching. If you enjoyed this video, please hit the like button and share it with a mama who needs a little extra support today. If you have any questions or comments, feel free to leave them below. We would love to hear from you. Don't forget to subscribe for more informative content. Stay healthy and see you next time.